Hello, and welcome to the MSU Sexual Assault Healthcare Program. The MSU Sexual Assault Healthcare Program has been created to ensure students, faculty, staff, and our community members have a place to access specialized services related to sexual assault. In this video, we are going to tell you about where we are located, explain what our program has to offer, why someone may choose to get an exam at our program, and what we are doing to ensure your privacy and well-being.
Our program is staffed 24 hours a day, 7 days a week by sexual assault nurse examiners. A sexual assault nurse examiner is a specially trained nurse who has the knowledge and skills to provide competent, comprehensive care to sexual assault patients in a trauma-informed and patient-centered way. We like our patients to feel empowered to make decisions about what type of care you may want or not want. We are here to answer any questions you may have about the services we offer.
The Sexual Assault Healthcare Program is located on the second floor in the Student Services Building on the corner of East Circle Drive and Farm Lane. There is free designated parking available 24/7 on Farm Lane. It is marked with a sign. If you are coming for an exam, you may park there. Once you have parked, the easiest way to get to our suite in the Student Services Building is to come through the east side of the building on Farm Lane. When you enter the building, you will see teal birds throughout the building to guide you to the suite. You can follow them up the stairs or by using the elevator. You may walk in or call ahead to the Sexual Assault Healthcare Program. We are dedicated to providing accessible health care to all. If language assistance is a benefit to your experience, we can accommodate your needs. If transportation is a barrier in seeking medical care at the Sexual Assault Healthcare Program, please call our nurses to discuss transportation assistance options.
When you walk into the program, you will immediately find our private waiting area. This is where you will be first introduced to the sexual assault nurse and to a medical advocate from Center for Survivors. Both will help walk you through all of your options and answer any questions. At any point during your time at the MSU Sexual Assault Healthcare Program, you have the option to stop or decline services. This includes whether you want to have a medical advocate present or any of the medical services we provide. Some patients choose to have evidence collected in case they want to report to police. Having evidence collected does not mean you have to report to police. It is a decision that you can make now or down the road. We can keep your evidence for up to 10 years.
If you have recently been assaulted and are considering reporting to law enforcement, we suggest that you refrain from showering prior to coming to the program, as this will aid in evidence collection. If we determine with you that clothing should be part of evidence collection, we have a closet with clothing to replace anything you may need. We also have a fully accessible shower and personal care toiletries available to you.
In addition to our nursing team, the Sexual Assault Healthcare Program works in collaboration with Center for Survivors to provide each patient with a confidential medical advocate. When you come in for services, a medical advocate is available to meet you and be by your side to provide support, inform you of your rights, help you make informed decisions, and connect you with additional support services.
These are the several reasons to get an exam. To check to see if you have any injuries that require medical care, to document pertinent findings, to evaluate and treat any risks for sexually transmitted infections, to provide pregnancy tests and emergency contraception, and to collect forensic evidence whether you report to law enforcement or store your kit at our program to use at a later date.
A common concern for people who are trying to decide whether they are going to seek medical care after a sexual assault is how their privacy and confidentiality will be maintained. We intentionally designed this space to ensure privacy and security for our patients, from making sure the space is soundproofed to having a private waiting room. We want patients to know that when they come, their privacy is extremely important to us. For example, if you come in for an exam, you will have the waiting room to yourself, with a support person if you wish. You will not be walking into a crowded waiting room. We also have systems in place to ensure that client records are confidential and separate from any other records on campus. The records we keep here are maintained on a separate, secure database.
We are here to be as supportive as possible and provide you with trauma-informed, patient-centered medical forensic care. We are here if you need us.